Thanks, Premier, and thanks, team, for the invitation today. As Premier said, I'm Michelle Spence, Royal Melbourne Hospital Nurse Unit Manager, and I've been in this role for about 13 years, but I've been an ICU nurse for about 24 years. I just wanted to provide some data to start with. Currently at Royal Melbourne Hospital, we have 135 patients with COVID-19. 19 of those are in ICU and 49 in our hospital and home. And as we speak, 8 are in ED waiting for beds. Since the end of July, we've had 90 patients at Royal Melbourne ICU. We're only one piece of the puzzle for ICU. I want to let you know, though, that not one of those 90 were fully vaccinated, not one. And that's not just Royal Melbourne, that's every ICU that we're seeing. The data is very clear to us about what's going on here. The average age is about 60, but I've seen patients in their 20s and 30s. During that time, during this period from August onwards, not only have we seen 90, you might think 90 is actually not really that high a number, but as well as the 90 patients with COVID, we've seen 750 other patients, trauma, stroke, cancer services. Those patients do not go away. They absolutely need our care as well, and we need beds available for every patient. We often run at about 100% capacity, and we know the next few months are going to be really, really tough, and we are working hard to have beds available, but we can't do this alone. COVID does not discriminate. We've worked our bums off the last 18 months. It does not discriminate. Last week I saw a 30-year-old with no past history be put on a ventilator with not 150 kilos, just a UNI, put on a ventilator because he wasn't, in my opinion, he wasn't vaccinated. That was his card out of this. But he didn't get vaccinated and now is on life support at Royal Melbourne. It is not old people. It is not people with comorbidities. It is not anything like that. It is absolutely, it does not discriminate, and I've seen it with my own eyes. One of the saddest things I've seen over the last few weeks is people wanting the vaccination just before we put them on a life support machine. That is the absolute truth. I've seen it myself. They're begging for the vaccination. They're very young, and once we get to that and we're about to put them on life support, it is really too late. They can have the vaccination down the track, that can be an option, but right then in their healthcare journey, it is too late, and their families are remorseful. They're begging us to give them the vaccination. This could be you. If you're waiting now to get the vaccination, if you are waiting, it is your window not to be this person. It is your window to absolutely not be another unnecessary statistic. Over the last even 18 months, we have had people die in our ICU by themselves. Sorry, it's making me emotional. And we held their hands. We hold their hands while their families have to be at home. And that is absolutely not what this should be about. Loved ones deserve to have their families with them when they die. Not only are we busy with COVID, we're busy with stroke, cardiac, cancer services, and as I said, we need these beds available for everyone. So over the last few months, I've seen lots of things in the media about how can they not be prepared? How can they've had 18 months. We absolutely are prepared. We have all the equipment we need. We have all the PPE. Every day we're opening more beds. We are absolutely are thinking a step ahead. What else do we need to do? How do we do it? But they're not the things that are the risk. The risk is the workforce. And the Premier's pointed that out. It's going to be a tough few months for our workforce. We are banding together to get this job done, but we cannot do it alone. So right now we're working through a number of workforce strategies locally and statewide. We are training ICU nurses. That usually takes a long time. We're training them in 4 days. They're coming in. They've never been in an ICU before. Guess what? They're now an ICU nurse and they're standing side by side with us. They're putting up their hand to help. That's not just nursing, that's support staff, that's cleaners, that's doctors, that's paramedics. Everyone is coming out of the woodwork to make this happen for us as a community, for you as a community, and we need you to help us. Very proud of my team. There's nothing that they can't achieve. And very, very proud to be a nurse in a pandemic. Who would have thought? I signed up for this. But we've got this. We will stand shoulder to shoulder. We will get this job done, but we cannot do this alone. We are absolutely begging you to go out and do the one thing you can do for yourself, the one thing you can do for your family and your loved ones, and the one thing you can do for your healthcare system is to get vaccinated. Please do not wait. I know you're frustrated. I know you're scared. I know you're over it. We're all over it. But it's time. It's time to absolutely make a difference. I just want to thank every Victorian for what they've done over the last 18 months. You've gone above and beyond. You have supported us, you've fed us, you've watered us. It's going to be a tough few months ahead, and I really thank you for everything you've done. Let's get this done and sunnier days in 2022. Thank you very much.